Hello, FPP. So I have done a few things that I need to show y'all. Starting on October 1st, we're starting our new QI goals for the providers, or really for our office as a whole, to try to do some quality improvement things. Those two are improved STI screening. So not just asking if they're sexually active, but actually completing the screening if they are. And then the other one is specifically asking about vaping. So those are two things that have been changed to the templates. So I'm going to show you what they look like and kind of what you need to do. On the 12 and up well child checkup, I have changed the questions just a little bit and only regarding those social questions. So it now says, have you used or currently use tobacco? And it has examples, so I would, read those to them. So including smokeless or dip, cigarettes, cigars, and those sort of things. And then separately asking them, have you used or currently use an electronic nicotine device? Most kids are probably not going to know what that means. So ask them specifically, vaping, e-cigarettes, Juul, all of those things. So that's all you have to do. Click yes or no. I will be reviewing charts from October to December to make sure that we are doing that. Please make sure that you are actually, asking. Don't just click one or the other, especially not no. If you didn't ask them, if you forget to ask them because it's a new question, that's okay. Either, go back, say, hey, I forgot to ask this new question, or let the provider know, I forgot to ask that. Do you care to ask it when you go in? Based on your provider, if you think that would be okay or not. The other one to help with that, nothing has changed as far as the questionnaire goes. I've just made it easier, hopefully, for you to order everything once we've done that. So, if they answer yes to the sexual intercourse, if we have not done any STI screening since their last partner, then we need to go ahead and order that. If you click on this STI template over to the side, merge it, don't override or you'll lose everything that you've already done. It will put in there pretty much all the fields that we need to put in. Get down there. So it has, the patient reports they're sexually active, which really it already said that. It also puts in the diagnosis code for you, as well as this little box saying that your urine sample was obtained. We're going to send that. It would not let me go ahead and put the order in, so you will have to create an order for this, but this is the code that you can use. So you'll still go, let me just jump to it, down to the plan here in the orders and order it through here. Everything else is in there, so you don't have to, put a little note saying that you did it. Also, if you or your provider will fill in this little plan note to get the patient's number, and the best time to call them is, as I hope you all know, if they're over 14 and they are sexually active and we obtain any results, whether even if they're negative, you can't call their parent and say, good news, your kid doesn't have gonorrhea. That all of that should go directly to the patient. If you have any questions about any of this or find any errors, please let me know. Thanks.